Good day, everyone. Welcome to a Psych 430 informative workshop on anorexia nervosa, led by Alana Rampasad, Amisha Mangal, Judah Scott, and Ray Sedandas of the Anorexia Nervosa or AN organization. The main objectives for this workshop will be to look at the characteristics of anorexia, some current statistics, the causes and available treatment options, preventative measures, and local support outlets. There will be some more extra information here and there. And in addition to this workshop, we have a flyer, a brochure, and a fact sheet with a lot of relevant information. So what is anorexia nervosa? Anorexia nervosa, simply referred to as anorexia, is an eating disorder driven by persistent self-starvation. Anorexic persons have an extreme fear of weight gain and a distorted perception of their body image, even though they already weigh significantly lower than normal. There are two types of anorexia, a restricting type and a binge eating purging type. A person with the restricting type achieves weight loss by restricting their food intake, by dieting or fasting, and by excessively exercising. So they try to eat as little as possible or not eat at all. On the other hand, a person with the binge eating purging type frequently expels ingested substances from their body, either by self-induced vomiting or taking medications like laxatives. So they eat, but they purge themselves afterwards.
History of anorexia nervosa. In 1969, an English doctor by the name Mr. Richard Morton reviewed two cases of what he called nervous consumption, with the main symptom being loss of appetite. However, in 1973, another English doctor named Sir William Gull saw similar cases and coined the term anorexia nervosa. Since then, there have been multiple studies done on this eating disorder, which accounts for the information attached to the disorder today. This information includes the definition, what it is, its characteristics, the different types, its treatments, its causes, and multiple other information that is connected to anorexia nervosa, the mental health disorder.
Characteristics of anorexia nervosa. The DSM-5 outlines specific criteria that an individual must fulfill in order to receive a diagnosis of anorexia nervosa. Firstly, an individual must show a restriction of energy intake or food relative to requirements, which results in a body weight that is significantly low for their age, sex, developmental stage, and physical health. The person's weight is less than what is minimally expected or normal. Secondly, an individual must have an extreme and unhealthy fear of gaining weight or show regular behaviors that interfere with weight gain. And this comes even though the person's body weight is already significantly low. And lastly, there must be a disturbance in the way an individual perceives their body weight or shape. There may be undue influence of body weight or shape on self-evaluation, or a failure to recognize the seriousness of low body weight. The DSM-5 also specifies based on type, current severity, and remission. Like we mentioned earlier, there are two types of anorexia, restricting and binge eating purging. A practitioner assessing a patient will look at their behaviors for the last 3 months to determine whether they have primarily accomplished weight loss by intense dieting, which would be the restricting type, or recurrent episodes of binge eating and purging, which would obviously be the binge eating purging type. In terms of a patient's level of severity, practitioners look at their current BMI. So a mild case of anorexia, a person's BMI would be more than or equal to 17 kg square. Moderate, the BMI would be between 16 and 16.99. A severe case, the BMI would be between 15 and 15.99. And in extreme cases of anorexia, a person's BMI would be less than 15 kg square. And for children and adolescents, practitioners will look at the corresponding BMI percentiles. In terms of remission, a person in full remission previously met the criteria for the disorder but has since failed to meet the criteria for a sustained period. A person in partial remission previously met the criteria for the disorder but now only meets either the second or third criterion and has not met the first for a sustained period. If you believe that you or someone you know may be suffering from anorexia nervosa, these are some signs that could help you or someone else make an informed decision to seek professional treatment. If you notice you or someone else developing irregular eating patterns, eating less and less, having a loss of appetite or denying hunger, it may warrant attention, and you may recall this as the restricting type. If you notice extreme weight loss, it may be a sign of anorexia. If there is an obsession with food, calories, and dieting, a person suffering from anorexia may have strict rules about what they eat, when they eat, and how much they eat. They may record each food item and their calorie intake, practice extreme dieting, and eliminate certain foods or food groups altogether. Also look out for a person who may have a preoccupation with their body image, weight, and shape. They may have a distorted view of their physical appearance and weight, and may believe and insist that they are too fat, even when others say that they are too thin. They may possess a constant but unattainable drive for thinness, and may routinely check themselves in a mirror or measure themselves in dissatisfaction. At times, a person suffering from anorexia may lose control of their eating habits and binge eat only to purge themselves afterwards to prevent weight gain by vomiting or taking laxatives. And you may recall that this is the binge eating purging type. If you notice moodiness in yourself or another person, particularly feeling low and irritable, there may also be signs of anxiety, impulsivity, social exclusion, and sensitivity to criticism. It may warrant attention to anorexia. Lastly, look out for excessive exercise to lose weight as a sign of anorexia. And of course, the more of these signs that are occurring simultaneously, the higher the probability that a person is anorexic. However, it is always best to seek professional help instead of self-diagnosing. Additionally, anorexic persons may develop certain physical characteristics or symptoms over time due to this prolonged self-starvation and restriction of required nutrients. These include irregular periods or the absence of menstruation in women, thin and brittle hair and nails, dry and yellow skin, feeling faint, weak, tired or sluggish, feeling cold all the time, poor memory, judgment or concentration, and severe bloating, constipation or stomach pains.
Anorexia nervosa is more prominent in women than men, however, it still happens to men nonetheless. Though these figures seem small, they are showing rapid increase due to the heavy influence of factors such as social media and peer pressure. Within the last 2 years, the percentage of individuals diagnosed with EN in Japan has increased at least 3 times due to what society deems as the acceptable size. Additionally, approximately 10% of diagnosed cases of EN result in death. This poses a major clinical, psychological, and societal burden on countries most affected.
Causes of anorexia nervosa.
Causes of anorexia nervosa. There are three dimensions by which anorexia can be rooted within an individual's life. These are biological, psychological, and environmental factorial influences. Biologically, anorexia can be caused by the transference of genetics from one generation to the next, meaning a close relative has been diagnosed with anorexia nervosa, a similar disorder, and or other mental health issues such as depression and anxiety. A person that has been diagnosed with anorexia nervosa also may have type 1 diabetes. Anorexia is also popular amongst other mental health issues with disorders such as depression and anxiety, meaning that other mental health issues can be a cause or it can be a result of anorexia nervosa. Someone who deals with depression and anxiety may have an eating disorder because of the current mental health issue that they have been diagnosed with. Also, because of being anorexic, that person can encounter depression and anxiety. In addition, an individual's environment can cause the aforementioned eating disorder because of dominant and unrealistic cultural beauty standards that most people strive to achieve within society. So, in society, there is something called media's influence. According to the Social Media Victims Law Center located in Seattle, USA, an examination was conducted on over 600 health food Instagram user followers. This examination proved that 49% of those individuals experience at least one symptom of anorexia nervosa. Media showcases an unrealistic standard by which we should live and look. Therefore, this contributes to eating disorders due to the desire to achieve those cultural standards. Apart from being a cause, media also creates a forum for bullying against those diagnosed with eating disorders.
Treatments for anorexia nervosa.
Treatment of anorexia nervosa. In treating an eating disorder, our first response may be to get dietary assistance. However, one of the main recommendations is to treat this disorder with therapy. Therapy alongside antidepressant medication can be used as methods of treatment for anorexia nervosa. The reason why therapy is one of the main treatment options for anorexia nervosa is because of its nature. This disorder is listed as a mental health issue, which can most be effective when treated by therapy. Anorexia nervosa can also be treated by a dietitian, giving the individual dietary pointers and direction. In a worst case scenario, hospitalization can occur. If the individual has extreme anorexia nervosa, they can be hospitalized due to the threat that it may cause to their physical being. Therefore, anorexia nervosa can be treated through therapy, through medications such as antidepressant pills, and finally, as a last resort, hospitalization.
Preventative measures for anorexia.
Preventative measures for anorexia nervosa. Prevention is any measure taken to stop or limit a phenomenon from occurring. The National Academy of Sciences Committee on the Prevention of Mental Disorders 2009 created 3 preventative programs for eating disorders. These are, firstly, Universal Primary Prevention Program. This program targets entire populations aimed at changing public policy, cultural patterns of behavior, and organizational structure. This program can be achieved through educational programs, active involvement in policy change, and basic environmental influential impact. Next is the Selective Prevention Program. This program is geared toward using preventative measure on high-risk groups that have not yet been diagnosed with the disorder. These may include teenagers and individuals with the biological background, environmental influences, and psychosocial influences connected to the disorder. Next, and finally, is the Indicated Targeted Prevention Program. This specific program also targets high-risk individuals and groups, but more specifically with milder symptoms. This group of people are not yet diagnosed with the disorder and is targeted to assist in stopping further development of these symptoms that are present in their lives.
Anorexia support in Trinidad and Tobago.
According to research, eating disorders such as anorexia, or AN, is an important area of concern in Trinidad, especially amongst young women. Treatments provided in Trinidad and Tobago include individual, group, and family counseling, coaching from regional clinics, and free healthcare at public hospitals. So in Trinidad, anorexia nervosa, which results in the restriction of energy intake relative to the requirements of the body, can be helped. No matter where you live, you can visit your regional health clinic to receive free coaching, as well as you can visit a public hospital free of charge. If necessary, you can be put on drips to receive nutritional value from these drips. And in addition to this, there are free counseling services provided by the government of Trinidad and Tobago, which can provide cognitive behavioral therapy, or CBT, as this helps people with anorexia nervosa to cope with their feelings and understand the importance of nutrition through education, as well as receive guidance for healthy food choices. In addition to hospitalization and therapy, medication can also be used alongside these methods in order to help with the psychological symptoms, medical aspects of the disorder, as well as behavioral symptoms. Anorexia can be complicated to treat due to the medical issues that come with being malnourished. However, antidepressants and anti-anxiety medication can help with the underlying psychological health issues, which can lead to the eventual curing of AN. Medication can be obtained in Trinidad and Tobago by private medical consultants and also public medical clinics at a subsidized cost. In addition to this, counseling about psychological related medicine to the treatment of anorexia can be accessed in free counseling services from the Trinidad and Tobago Association of Psychologists, as well as the National Family Services Division of the Ministry of Social Development and Family Services.
This brings us to the end of our workshop. Thanks for viewing. On the screen here, you can find our information. And if you would like to know more about anorexia nervosa, please see our flyer, brochure, and fact sheet for more information. And these are the references we use to gather our information.